idea by kids who've been diagnosed with autism feel they can either improve or cure it by taking gluten out of the diet. Is that true?
That's a very controversial issue, and I think that needs to be addressed on an individual basis to that. I don't think there's a yes, no answer. I know for a fact this has been addressed by 15 smarter experts than me at the Pediatric, Gastroenterology, and Nutrition committees who've investigated this, and there is no answer at this time.
If you even thought you were going to try it, it's not a simple 1, 2, 3 type diet.
If you wanted to do it, it probably should be done under the care of a physician nutrition specialist or a pediatric gastroenterologist with specialty in nutrition.
We both agree that certain foods can trigger behavior of the brain to some degree.
For sure.
So if it was done, I don't know if it would cure autism, but if the kid had a reaction to the food, it might improve the kid's behavior to some degree. Is that true?
Yes.
So that I would agree with. But I'm really not sure if it would cure the kid of the condition. Reasonable to think that way?
I agree with what you're saying.
Okay, and a lot of people don't realize that if you take a kid who has a condition like autism and you did absolutely nothing, 20% of them are better by the age of 4 without any therapy. So if you did something along the way, it's very easy to say, what I did made the kid better. So what we really need is a national study, an evidence-based studies, studying many children, carefully watch that stuff was done correctly, and maybe we would get the right information. So far, I haven't seen good evidence-based studies or collaboration of a bunch of studies put together so we can make the right decision. But if anybody's thinking about it, you should not just say, I'm going to get rid of wheat. That isn't a gluten-free diet. You can find gluten sometimes contained just in toothpaste. And one little bit is enough to set you back 6 months. Is that true?
It's even found in the lipstick that mom might be wearing, and she might be kissing the child, and even it's in so many places that we don't even know.
So that could make a failure when there could have been success, or many people think it's just stopping wheat in itself is a gluten-free diet, which is a big myth.
I agree with you. It's a very, very difficult. I agree with you. Multi-centered studies with a lot of evidence.
And there's one other thing that bothers me when we use the word autism. A lot of labeling to kids who may not have autism have been added. And I think if we're going to make these studies, we have to define that word specifically. Is this a kid that is severe, that doesn't communicate, doesn't make social contact, has some repetitive actions, the classical case, or some kid that has some variant of it? And I don't see studies published that way. They say, this is happening, more autistic kids have a father who's over 40. What are they calling the word autism? That isn't clear in a lot of the studies I've been reviewing. So if we're going to talk about it, we have to talk, is this a classical or a variant? And maybe we should define all the variants like we do with subtypes in certain cancers. We study on a national basis.
Maybe there are 300 different levels of autism. There are 300 different genotypes of cystic fibrosis.
So each one might have a different way of approach. And we should do what we did with cancers in the 50s. We study them on a national basis. If someone did this kind of therapy, at this order, at this amount, we got this result. So if we took a kid and we put a kid on a particular therapy, it improved that form or that subtype, maybe we could get more information. And always ask the question why. Why aren't these studies being done? Because it's very important to find out what we can do to help all children with this potential diagnosis.